Question 1. A patient has damage to the pelvic splanchnic nerves. Which of the following functions is most likely impaired? A. Pupil dilation. B. Bladder contraction. C. Sweating. D. Increased heart rate. E. Bronchodilation. B. Bladder contraction. Explanation. Pelvic splanchnic nerves are part of the parasympathetic system, which stimulates bladder contraction for urination. Damage can cause urinary retention. A. Pupil dilation is sympathetic. C. Sweating is sympathetic, cholinergic. D. Increased heart rate is sympathetic, beta 1. E. Bronchodilation is sympathetic, beta 2. Question 2. Which of the following pathways uses acetylcholine at both the preganglionic and postganglionic synapse? A. Sympathetic to sweat glands. B. Sympathetic to blood vessels. C. Parasympathetic to heart. D. Somatic motor to skeletal muscle. E. Adrenal medulla stimulation. Correct answer C. Parasympathetic to heart. Explanation. Parasympathetic nerves release ACH at both synapses, nicotinic at the ganglion and muscarinic M2 at the heart. A. Sweat glands use ACH, but it's only the postganglionic fiber. The preganglionic still synapses in the sympathetic chain. B. Sympathetic to vessels uses norepinephrine. D. Somatic nerves release ACH once, not at two synapses. E. Adrenal medulla receives ACH, but it directly releases epi-NE, no postganglionic synapse. Question 3. The sympathetic innervation to sweat glands is unique because A. It uses dopamine instead of norepinephrine. B. It is under voluntary control. C. It uses acetylcholine on muscarinic receptors. D. It bypasses the sympathetic chain. E. It uses only one neuron sign. Correct answer, C. It uses acetylcholine on muscarinic receptors. Explanation. Unlike most sympathetic targets, sweat glands are innervated by cholinergic postganglionic neurons that release ACH onto M3 muscarinic receptors. A. Dopamine is used in renal sympathetic vasculature. B. Sweat is autonomic, not voluntary. D. It passes through sympathetic ganglia like others. E. There are two neurons involved, preganglionic and postganglionic. Question 4. A drug that blocks beta-1 adrenergic receptors would primarily affect A. Sweating. B. Bronchodilation. C. Renal vasodilation. D. Heart rate. E. Pupil dilation. Correct answer, D. Heart rate. Explanation. Beta-1 receptors are found in the heart and increase heart rate and contractility when activated. A. Controlled by muscarinic receptors, sweat glands. B. Mediated by beta-2, not beta-1. C. Dopamine D1 affects renal vasculature. E. Alpha-1 adrenergic receptors cause pupil dilation. Question 5. Which receptor is found at the neuromuscular junction in the somatic nervous system? A. Nicotinic N. B. Muscarinic M3. C. Adrenergic alpha-1. D. Nicotinic. Correct answer, D. Nicotinic N. Explanation. Somatic motor neurons release ACH at the neuromuscular junction, which binds to nicotinic NM receptors on skeletal muscle. AN is an autonomic ganglia. B. M3 is for smooth muscle glands and parasympathetic pathways. C. Alpha-1 causes vasoconstriction. E. Beta-2 causes bronchodilation and vasodilation. Question 6. Which neurotransmitter is released from the adrenal medulla into the blood after sympathetic stimulation? A. Acetylcholine. B. Dopamine. C. Epinephrine. E. Histamine. C. Epinephrine. The adrenal medulla is stimulated by ACH but releases epinephrine and norepinephrine directly into the bloodstream. ACH stimulates the adrenal medulla but is not released into the blood. B. Dopamine is for renal vasculature. D. E. Not involved in. Question 7. Which receptor type is targeted in the bladder by parasympathetic nerves to cause contraction? A. Beta-2. B. Muscarinic M3. D. Nicotinic N. E. Dopamine D1. C. Muscarinic M3. Explanation. Parasympathetic stimulation of M3 receptors causes detrusor muscle contraction for urination. A. Beta-2 relaxes smooth muscle. B. Alpha-1 contracts sphincters, sympathetic. D. NN is in ganglia, not on target organ. D1 vasodilates renal blood vessels. Question 8. A patient is sweating. Which neurotransmitter is responsible for activating the sweat glands? A. Epinephrine. B. Acetylcholine. C. Dopamine. D. Norepinephrine. E. Serotonin. B. Acetylcholine. Explanation. Sweat glands are part of the sympathetic system but use satiety to act on M3 receptors. A and D. Released by adrenal medulla or sympathetic nerves to smooth muscle, not sweat. C. Used in renal vasculature. E. Not involved in autonomic control of sweat. Question 9. Which pathway uses dopamine as the neurotransmitter at the target organ? A. Somatic motor neurons. B. Sympathetic innervation of renal vasculature. C. Parasympathetic innervation of GI tract. D. Sympathetic innervation of sweat glands. E. Sympathetic innervation of the heart. Correct answer. B. Sympathetic innervation of renal vasculature. Explanation: some sympathetic postganglionic neurons release dopamine to act on D1 receptors in renal vessels. A. Somatic uses ACH. C. Parasympathetic uses ACH. D. Uses ACH, not dopamine. E. Uses norepinephrine, beta 1. Question 10. A patient receives a muscarinic antagonist. Which effect is most likely? A. Increased urination. B. Pupil constriction. C. Bradycardia. D. Dry mouth. E. Increased GI motility. Explanation: muscarinic antagonists block parasympathetic activity, including salivation, leading to dry mouth. A. Blocking M3 causes urinary retention, not urination. B. Parasympathetic constricts pupils. Blocking it causes dilation. C. Bradycardia is mediated by M2. Blocked equals increased HR. E. GI motility decreases, not increases. Let me know if you'd like a